Another day, another story. 1. A nurse is performing an admission assessment on a patient and attempting to obtain subjective data about the patient's sexual and reproductive status. The patient states, "I don't want to discuss this, it's private and personal," which statement, if made by the nurse, indicates that the nurse is therapeutic. A. I hate being asked these sorts of questions too. B. I am a professional nurse and as such I'll have you know that all information is kept confidential. C. I know that some of these questions are difficult for you but, as a professional nurse, I must legally respect your confidentiality. D. This is difficult for you to speak about, but I am trying to perform a complete assessment and I need this information. Answer: C. Rationale: Option C is the only option that identifies a therapeutic response. In option A, the nurse's feelings are the focus. This response clearly ignores the fact that the issue is about the patient and patient's discomfort, not about the nurse. The nurse becomes pompous and a bit angry and supercilious, which is not therapeutic. In option D, the nurse begins correctly with empathic stance but then becomes demanding. 2. A nurse is caring for a Native American patient who says, "I don't want you to touch me. I'll take care of myself." Which nursing response is most therapeutic? A. Okay. If that's what you want, I'll just leave this cup for you to collect your urine in after breakfast, I will take more blood from you. B. If you didn't want our care, why did you come here? C. Why are you being so difficult? I only want to help you. D. It sounds as though you want to take care of yourself. Let's work together so you can do things for yourself. Answer: D. Rationale: Native Americans view touch very differently from other Americans. The most therapeutic response is one that reflects the patient's feelings and empowers the patient by offering self-control over one's own care. In option A, the nurse uses avoidance and information giving. Option B is an aggressive and non-therapeutic communication technique. Option C labels the patient's behavior and is likely to provoke anger. 3. A nurse completes the initial assessment of a patient admitted to the mental health unit. The nurse analyzes the data obtained on assessment and determines that which of the following presents a priority concern? A. The presence of bruises on the patient's body. B. The patient's report of not eating or sleeping. C. The patient's report of suicidal thoughts. D. The significant other's disapproving of the treatment. Answer: C. Rationale: The patient's thoughts are extremely important when verbalized. A patient's report of suicidal thoughts is of the highest priority. Option A, B, and D will affect the treatment of the patient but are not of greatest importance at this time. 4. A nurse is providing care to the patient admitted to the hospital with diagnosis of acute anxiety disorder. The nurse is conversing with the patient. The patient says to the nurse, "I have a secret that I want to tell you, you won't tell anyone about it, will you?" The most appropriate nursing response is which of the following? A. No, I won't tell anyone. B. I cannot promise to keep a secret. C. If you tell me secret, I will tell it to your doctor. D. If you tell me the secret, I will need to document it in your record. Answer: B. Rationale: The nurse should never promise to keep a secret. Secrets are appropriate in a social relationship but not in a therapeutic one. The nurse needs to be honest with the patient and tell the patient that a promise cannot be made to keep the secrets. 5. Laboratory work is prescribed for a patient who has been experiencing delusion. When the nurse approaching the patient to obtain specimen of the patient's blood, the patient begin to shout, "You're all vampires, let me out of here." The most appropriate nursing response is which of the following? A. I am not going to hurt you, I am going to help you. B. What makes you think that I am a vampire? C. I'll leave and come back later for your blood. D. It must be fearful to think others want to hurt you. Answer: D. Rationale: Option D helps the patient to focus on the emotion underlying the delusion but does not argue with it. Option C avoid the patient. Option B places the patient in a position that requires a response. Option A is an attempt to convince the patient to believe another thought. This response may cause the patient to hold the delusion more strongly. 6. A supervisor reprimands for a nurse in charge of a nursing unit because the charge nurse has not adhered to the unit budget. Later that afternoon, the charge nurse accuses the nursing staff of wasting supplies. This in an example of A. Denial. B. Repression. C. Suppression. D. Displacement. Answer, D. Rationale, ego defense mechanism are operations outside a person's awareness that the ego calls into play to protect against anxiety. Displacement is the discharging of pent-up feelings on persons less dangerous than those who initially aroused the emotion. Denial is the blocking out of painful or anxiety-inducing events or feelings. Repression is unconsciously keeping unacceptable feeling out of awareness. Suppression is consciously keeping unacceptable feelings and thoughts out of awareness. 7. During the termination phase of the nurse-patient relationship, the clinic nurse observes that the patient continuously demonstrate bursts of anger. The most appropriate interpretation of the behavior is that the patient A. Requires further treatment and is not ready to be discharged. B. Displaying typical behaviors that can occur during examination. C. Needs to be admitted to the hospital. D. Need to be referred to the psychiatrist as soon as possible. Answer, B. Rationale, in the termination phase of relationship, it is normal for the patient to demonstrate a number of regressive behavior that can be disturbing to nurse. Typical behaviors include return of symptoms, anger, withdrawal and minimizing relationships. The anger that the patient is experiencing is a normal behavior during the termination phase and does not necessarily indicate the need for hospitalization or treatment. 8. A nurse is preparing to provide reminiscence therapy for a group of patients. Which of the following patients would the nurse select for this group? A. A patient who exhibits profound depression with moderate cognitive impairment. B. A catatonic, immobile patient with moderate cognitive impairment. C. An undifferentiated schizophrenic patient with moderate cognitive impairment. D. A patient with mild depression who demonstrate normal cognition. Answer, D. Rationale, reminiscence therapy is best for the patients who meet the following criteria: normal to mild cognitive impairment, mild to moderate depression, withdrawn, socially isolated, understimulated behavior. 9. A nurse is monitoring a group therapy session. During the session, the members are identifying task boundaries. The nurse determines that these activities are characteristics of which stage of group development? A. Forming. B. Storming. C. Norming. D. Performing. Answer, A. Rationale, in the forming or initial stage, the members are identifying tasks and boundaries. Storming involves responding emotionally to tasks. In the norming stage, members express intimate personal opinions and feeling around personal tasks. In the performing stage, members direct group energy toward the completion of tasks. 10. A nurse is planning to formulate a psychotherapy group. Several patients are interested in attending the session. The nurse plans the group, knowing that maximum number of group members to include in this group. A. 10. B. 12. Circa 14. D. 16. Answer, A. Rationale, the ideal number of patients in a psychotherapy group ranges from 7 to 10. Having more than 10 members is not recommended because the group will subdivide it, which is counterproductive. Too large a group can also create more opportunities for acting out, as opposed to working through issues. 11. A patient with an eating disorder is planning to attend group meetings with Overeaters Anonymous. The nurse describes this group to patient, knowing that which of the following is not a characteristics of this form of self-help group? A. People who have a similar problem are able to help others. B. It is designed to serve people who have a common problem. C. The members provide support to each other. D. The leader is a nurse or psychiatrist. Answer, D. Rationale, the sponsor of self-help group is an experienced member of the group. A nurse or psychiatrist may be asked by the group to serve as a resource but would not be a leader of a group. Options A, B and C are characteristics of a self-help group. 12. A nurse is caring for a patient with a phobia who is being treated for the condition. The patient is introduced to short periods of exposure to the phobic object while in a relaxed state. The nurse understands that this form of behavior modification can best described as A. Systematic desensitization. B. Self-control therapy. C. Milieu therapy. D. Aversion therapy. Answer A. Rationale: systemic desensitization is a form of therapy used when the patient is introduced to short periods of exposure to the phobic object while in a relaxed state. Gradually, exposure is increased until the anxiety about or fear of the object or situation has ceased. Option B, C and D are incorrect. 13. A patient asks a nurse about milieu therapy. The nurse responds, knowing that the primary locus of milieu therapy can be described as which of the following? A. A form of behavior modification therapy. B. A cognitive approach to changing behavior. C. A living learning, or working environment. D. A behavior approach to changing behavior. Answer C. Rationale: milieu therapy, or therapeutic community, has as locus a living, learning, or working environment. Such therapy may be based on any number of therapeutic modalities, from structured behavioral therapy to spontaneous, humanistically oriented approaches. Although milieu may include behavioral approaches, its primary focus is described in option 3. 14. A nurse is developing a plan for a patient who is scheduled to have electroconvulsive therapy, ECT. Which nursing diagnosis is a priority for this patient? A. Fear. B. Anxiety. C. Risk for aspiration. D. Body image disturbance. Answer C. Rationale: aspiration is safeguarded against by keeping the patient NPO for 6 to 8 hours before ECT, removing dentures, and administering procedure medications as prescribed. Although options A, B could be appropriate nursing diagnoses, they are not the priority. There is no reason to assume that option D is even a consideration. 15. A nurse is performing an assessment on a patient with dementia. Which data gathered during the assessment would indicate a potential complication associated with dementia? A. Presence of personal hygienic care. B. Improvement in sleeping. C. Absence of sundowner's syndrome. D. Confabulation. Answer D. Rationale: the clinical picture of dementia varies from the development of mild cognitive defects to severe, life-threatening alterations in neurological functioning. It is not unusual for the patient to employ confabulation or the fabrication of events or experiences to fill in memory gaps. Often a lack of inhibition on the part of the patient may constitute the first indication of anything being wrong to the patient's significant others. The patient may undress in front of people or demonstrate slovenly table manners. Whereas in the past the patient was very well-mannered, as the dementia progresses, the patient will have episodes of wandering or sundowning. 16. A patient is participating in a therapy group and focuses on the viewing all team members as equally important in helping the patients meet their goals. The nurse is implementing which therapeutic approach? A. Milieu therapy. B. Interpersonal therapy. C. Behavior modification. D. Support group therapy. Answer A. Rationale: all treatment team members are viewed as significant and valuable to the patient's successful treatment outcomes in milieu therapy. Interpersonal therapy is based on one-on-one or group therapy approach in which the therapist-patient relationship is often used as a way for patients to examine other relationships in their lives. Behavior modification is based on rewards and punishment. Support groups are based on the premise that individuals who have experienced and are insightful concerning a problem are able to help others who have a similar problem. What is the most appropriate nursing action to help manage a manic patient who is monopolizing a group therapy session? A. Ask the patient to leave the group for this session only. B. Refer the patient to another group that includes other manic patient. C. Tell the patient to stop monopolizing in a firm but compassionate manner. D. Thank the patient for the input, but inform the patient that others now need a chance to contribute. Answer: D. Rationale: if a patient is monopolizing the group, the nurse must be direct and decisive. The best action is to thank the patient and suggest that the patient to stop talking and try to listen to others. Although telling the patient to stop monopolizing in a firm but compassionate manner may be a direct response, the correct option is more specific and provides direction for the patient. The remaining options are inappropriate because they are not directed toward helping the patient in therapeutic manner. 18. The nurse in the mental health unit plans to use which therapeutic communication techniques when communicating with a patient? Select all that apply. A. Restating. B. Active listening. C. Asking the patient why. D. Maintain neutral response. E. Providing acknowledgement and feedback. F. Giving advice and approval or disapproval. Answer: A, B, D, E. Rationale: therapeutic communication techniques include listening, maintaining silence, maintaining neutral responses, using broad openings and open-ended questions, focusing and refocusing, restating, clarifying and validating, sharing perceptions, reflecting, providing acknowledgement and feedback, giving information, presenting reality, encouraging formulation of a plan of action, providing nonverbal encouragement, and summarizing. Asking why is often interpreted by the patient as being accusatory and would also be avoided. Providing advice and giving approval or disapproval are barriers to communication. The nurse calls security and has physical restraints applied to a patient who is admitted voluntarily when the patient becomes verbally abusive, demanding to be discharged from the hospital. Which represents the possible legal ramifications for the nurse associated with this interventions. Select all that apply. A. Libel. B. Battery. C. Assault. D. Slander. E. False imprisonment. Answer: B, C, E. Rationale: false imprisonment is an act with the intent to confine a person to specific area. The nurse can be charged with false imprisonment if the nurse prohibits a patient from leaving the hospital if the patient has been admitted voluntarily and if no agency or legal policies exist for detaining the patient. Assault and battery are related to the act of restraining the patient in a situation that did not meet criteria for such an intervention. Thanks for watching.